So the SALHN Youth Stream provides young people aged 16 to 24 years of age and their families with accessible, youth-friendly and evidence-based mental health services. We service regions in the inner and outer south, so we've got a location here at Marion GP Plus and at the Noarlunga GP Plus.
And one of the great successes has been partnering with a philanthropic agency, a research foundation and SALHN together to create programs that will be ongoing and embedded, delivering group interventions for our community.
Researching the neurosurgery waitlist, we found that it was one of the largest waitlists in the state a couple of years ago. And we're implementing a new model of care where a physio goes into the neurosurgery clinic and sees non-urgent spinal patients, help basically assess them, give them a pathway for their healthcare, and takes a bit of pressure off the surgeons and frees them up to do surgery, and also decreases the waiting list. We're also doing a comparison between effectiveness, satisfaction and quality.
So the patient and family representatives work in partnership with the staff to provide holistic care. The purpose is to really amplify the patient voice to deliver better health outcomes, championing the voice of the consumer, representing the communities that they come from, providing advice and feedback, but also actively being engaged in decision making across all levels of the organisation.
I chair the SALHN Wellbeing Committee, which is a group of multidisciplinary individuals who are seeking to develop and deliver a wellbeing strategy for the whole of SALHN. I also am the clinical lead for Schwartz Rounds, which are again a multidisciplinary all-of-staff forum that really focuses on the emotional and the social impact of the job that we as healthcare providers do. And we've been providing monthly rounds which allow staff to really talk about the unique emotions that we come across in our day-to-day work.
As part of the flipping language that we do here at the MBU, we look at language that's used in your everyday clinical settings, and we see how that impacts people coming into services.
Family really appreciate to come here and speak with our team and see things so differently. It's just this relief, I guess, is probably the easiest way to think about it.
We set up this Lived Experience Stroke Volunteer program to have our volunteer stroke survivors to come to the ward and talk to our stroke patients and their family. In the past year, our volunteer had spoken to over 1,000 patients and family, and they told us that the volunteer gave them hope that there is life after stroke.
I've always loved helping people. I've always been a giver, and I also had to find a new life's purpose.
We've been running a clinic, an audiology, hearing and ear health screening at the Aboriginal Family Clinic in Noarlunga since January 2020. So the aim of the program is to do hearing screenings in children, but more recently onto adults as well. And there's been a lot of barriers with accessing the service in more hospitals. So that's why we're going down to the clinic in a more culturally safe environment.
With our community, early detection is a great indicator for the amount of clients that we're getting nowadays. We're getting a lot of young people coming in and they're getting the services they need before they end up with speech delays or any kind of issues that can lead on further in their lives. I think that's a really great thing that we're being able to provide for community.